Which injectable procedure should I get for my 11s? I am turning 37 in 2 weeks, and I finally want to take care of these lines. I want to get the best results with minimal healing time, so I can go back to work on a Monday without looking weird.
Thank you for your question. You stated in your question that you are turning 37 in 2 weeks and you want to finally do something about your number 11s. And at the same time, you want to do something so that it's not obvious when you go back to work on Monday. Well, I can certainly guide you with how we approach patients like yourself in our practice. I'm a board-certified cosmetic surgeon as well as a fellowship-trained oculofacial plastic surgeon, and I've been in practice in Manhattan and Long Island for over 20 years. So to help you understand a little bit about the number 11s and how to set your expectations and determine what is the best strategy for you, I think it would be a good idea for you to learn what causes the number 11s. So as you are probably aware, this area called the number 11s are also referred to as the glabella or glabellar lines, and it's due to the activity of two sets of muscles. One is called the corrugator, the other is called the procerus muscle. These muscles get engaged for people who have deep number 11s every time they're thinking, every time they're angry, every time they are, this muscle gets a lot of activity. Now, one of the things about being an oculofacial plastic surgeon is that our specialty was one of the first back in the early 90s to use Botox. And one of the conditions that we treated a lot before the cosmetic indication was a condition called benign essential blepharospasm. And this was a condition where the eyes gets forcibly closed involuntarily. And the corrugator and procerus muscle is a muscle that was very active in these patients. So what was noticed is that with repeat injections, the lines got less deep, which means that if you think about it as short-term versus long-term, with long-term view, if you do Botox or Dysport, which are neurotoxins to relax the muscles, certainly you can go to work Monday if you do it on a Friday without any problem, or maybe the low likelihood of some kind of pinpoint bruise or something of that nature. But you may not see the full correction, which is actually unlikely, because the muscle, once it relaxes, and it usually takes about 3 days for the muscles to relax and then 2 weeks for the peak of the effect of the Botox, the lines will be less deep, but it doesn't mean they'll be gone. When you do this treatment every 3 to 6 months over the course of a year, 2 years, or beyond, then you'll see really significant improvement because those muscles aren't continuously contracting. Now, in some patients, the skin is so deeply creased that there is value in adding some type of volume correction. For those patients, we use a hyaluronic acid filler such as Restylane. We also often combine that with a material called platelet-rich plasma. And this is derived from your own blood, and it stimulates collagen growth and blood supply. Because essentially when you think about the skin indenting and creasing, there's a collapse of the foundation or collagen. So there's value in doing that. Now, the glabella is a very sensitive area, and there have been reported incidents of vascular compromise with injectables. So it's very important that this area be treated very, very carefully to avoid those complications. So understanding that there's the muscle activity, which the gold standard is to use a neurotoxin like Botox or Dysport, and then there's the volume loss in the skin where some type of volume correction is also worth considering depending on what kind of results you're looking for. So I hope that was helpful. I wish you the best of luck, and thank you for your question.